My role is, as the nurse, I come in roughly once a week to do support sessions with the individuals, looking at health needs and access to health services, but also do health promotion and health education. We do things like smoking cessation, addiction support, in group settings as well as one-to-one support. We also organise other events out with the homeless units. For instance, we have a football group on a Tuesday, a lunch group on a Wednesday, and we have access to the leisure centres locally through a voucher scheme. The main aim of the job, so I'm a North Ayrshire, and this is a Pan Ayrshire, there's 3 nurses in the whole of Ayrshire, and our main role is to gain people to gain access to mainstream health services and voluntary services. So we're looking at what are the health needs of the individuals and how we can support them into getting that service. The basic requirement is GP access, so we developed a GP access leaflet with the GP subgroups, looking at how we can get people access. We have get fast tracking services into dental health, sexual health. We have podiatry services that come once a month to a clinic close by the hostel that people can access. We have naloxone training for staff, and I train people in naloxone. Also do sexual health support, do chlamydia and gonorrhea testing in the hostels, and I arrange the testing, the results and the antibiotics if required. It really is any health need that is highlighted by the individual we try and address as best we can. If I can't address it, then I bring other members of health professionals in to try and help that situation. I started off as a health visitor, and then this was the role we moved into. We have pathways into services as well. For instance, to prevent children missing in the system, we've got a system where any child that comes into homeless accommodation, I get contacted, and that information is relayed to the health visitor. We also do the same with pregnancy. Anyone that's pregnant, I get a referral, and it goes straight to the vulnerable in pregnancy midwifery service. To reduce the amount of missing children, people that are not taking up healthcare in pregnancy. So that's another sort of arm to our bow. We're looking at just now at pathways into mental health services to improve that. Addiction services, we have a fortnightly meeting with the addictions team to bring new cases to the addiction team, and also to discuss cases that are already within the service. We developed a GP access leaflet, and it is a 4-pronged attack. So if someone comes into Ayrshire and they're not registered locally at a GP, they have the access leaflet that allows them to know exactly what to do. Most people are registered as a temporary registration until they've found a permanent address, but they can be in a temporary registration for 3 months. What we also have is a GP ID letter, because the GPs now want photographic ID. Our patients don't have photographic ID. So what we do is the council have developed an ID letter in cooperation with the health board. So we use that. We use the ID letter so that people can get registered. I get information when there is a difficulty, and so far in the past 6 months I have had no referrals about difficulty getting access to GP services. Within Ayrshire and Arran we also have a GP service for people that have been excluded from mainstream services, which is only open, run once a week, but it's for people that have been excluded from mainstream GP services. So I'm in contact with them as well. Yes, I do. Yes, I really enjoy my job. I've been 7 years in post so far, so I really enjoy it. I really work with the clients, and the staff are very, very helpful. I feel part of the team, so I don't feel as though I'm an outside agency coming in, so which is really good.